If you have or suspect you may have a health problem, or if you require answers to specific healthcare questions or concerns, you should consult your physician or healthcare provider and not depend solely on information presented in this program.
Hello, I'm Dr. Steve Garner, and welcome to the season finale of the 9th season of Ask the Doctor. This series was created to assist you in understanding medical issues so you can take charge of your own health. It is more important than ever to become an informed patient, and we're here to bring you timely health discussions. As an example of that, I would like to begin this episode with a recap of last week's session at Brooklyn College. I was there with Dr. Marguerite Katsina and Dr. Antonio Muscatello. We had a lively, informative session with many of you. This was our second time at Brooklyn College, and many of the questions this time around were related to the H1N1 or swine flu virus pandemic. The questions were excellent, so we want to thank those who brought them up, and I want to especially thank Dr. Katsina and Dr. Muscatello for participating. And last but not least, I want to thank Linda Lapatosa and Ann from Brooklyn College for arranging this event. We'll touch upon some of those questions later in this jam-packed episode. For this episode, I have Dr. Claudia Lapidus. She's a radiology attending at New York Methodist Hospital. Then we have Dr. Daniel Stevens, a general surgeon at Metropolitan Hospital in Manhattan. And last but not least, Dr. Thomas Rusi, a pulmonary attending at New York Methodist Hospital. Welcome. Now, as I mentioned earlier, a lot of the questions at Brooklyn College were regarding the swine flu. So in the news, let's do a quick update. And many of you may have heard that the president declared a state of emergency last Friday for the swine flu. And it actually panicked a lot of people. But in fact, it's really not a change in anything except that it allows doctors and hospitals to see patients in a much more streamlined event than in the past. So for example, doctors and hospitals can set up tents in the parking lot to see swine flu patients, if there should be a lot that are there. And also, the HIPAA, the protection of the patient's privacy, which requires a door or an area where the doctor can talk to the patient about his health, is also bypassed in that event. So should there be a lot of cases, which hopefully there won't be, the president has now set the wheels in motion to get this done. Now, I thought that swine flu, particularly for pregnant women, is critical, that they get the vaccine because it seems to be affecting pregnant women in a much more destructive way than it affects other age groups. So I have three questions that I want to discuss, the three most popular questions that I'm asked, and the rest I'm going to put on the forum with the answers. So the number one question that pregnant women want to know is, why should I get the swine flu vaccine? And the answer to that is that during pregnancy, your immune system doesn't function as well as when you're not pregnant. Also, the baby, as the baby gets bigger, it stops it hinders your breathing. We'll talk to Dr. Rusi a little bit about this. So it makes you more prone to pneumonia and deadly pneumonia. And there have been many miscarriages and women admitted to the hospital who are pregnant at a proportion to those, 6 times as many as we'd expect. So I know people say, I don't want to get that vaccine. For pregnant women, you don't have a choice. You have to get it. This will protect you, and it'll protect the unborn baby. And also the first 6 months of the baby's life will be protected against the swine flu as well, because the vaccine will work for the baby. Question number 2, will the vaccine hurt my unborn baby? And again, to the contrary, it helps the unborn baby because it gives that baby immunity to the swine flu when he's born, and for the first 6 months, in which he can't get a flu shot. Babies only get flu shots from 6 months on. And the third most popular question is a nonsense question about mercury, which a lot of people are bringing up. I'm afraid it's going to cause autism. Well, the mercury, number one, in a flu vaccine is less than a can of tuna. Okay, that's number one. And number two, none of the studies have ever shown that it causes autism. But if you're still concerned about it and you say, I don't want mercury, there are doses of the swine flu vaccine without mercury, so ask your doctor. And the name of the chemical that contains the mercury is called thimerosal. So just ask your doctor for the one without thimerosal or mercury-free. Now, we have a slightly different approach to our quiz this week. We're going to have 2 quizzes in-house and 1 quiz later on I'm going to talk about in the forum. Now, the first quiz is a tricky one. It's naming 2 cities with 6 letters each in the United States that rhyme with one another. Again, I'll repeat that name. 2 cities in the United States, popular cities containing 6 letters each in the name that rhyme with one another. All right, I'm going to see if we can get that one. I have faith in the audience, but let's see. And the second question, and this is an audio daily double, so to speak. What Christmas song has sold the most copies in history? Now, in order to get this right, you have to sing the first 2 verses of it. And if you don't sing, you can't do it. So we'll get to a second quiz a little bit later, a third quiz a little bit later on. I want to hold off because I don't want to overwhelm the minds out here of our listeners. So just stay tuned for the third question, which will be on a little bit longer. And that question you'll answer on the forum, the website on the forum. So now that we've gotten a lot of this out of the way, let's say our phone number is, as always, 718-499-6101. You can call and talk about radiology, any type of surgery problems you've had, or you're contemplating surgery, you've had complications, surgical problems, and lung disease. So we're going to take a short break. We got a lot of excitement here tonight. I don't know if you can feel it in the air. I feel this excitement. Anyway, when we get back to the phone, it's 718-499-6101. Don't go anywhere. We'll be right back. I'm Dr. Steve Garner, the host of Ask the Doctor. In addition to watching Ask the Doctor every Tuesday night at 8, you can also visit www.netny.net/askthedoctor. There you can find the topics and guests of each episode. You can read my column from the week for the tablet, and for more advice, you can watch episodes you've missed. More importantly, you can post your questions and I'll answer them on the video blog. So visit www.netny.net/askthedoctor and get your daily dose of healthy advice. And welcome back to Ask the Doctor. Our phone lines are all lit up. This is the earliest I've ever seen them this lit, and I think people are fearful we're not coming back. They're getting all the questions, but we will be back next season, so don't worry about that. I want to say hello to Monsignor Bennett, who's joined us on our season finale. Monsignor, thanks, as always. Nine seasons in a row. He hasn't missed an episode. So you'll have a break for the next few weeks, then you'll come back. Quick hello to Linda Jones, a very nice person I ran into at Methodist Hospital. When we picked her up after I ran into her, she was well, but she's a very nice woman. And also my barber, I have to say, did a nice job, Vinny. And thank you, Vinny, of Hair Pleasure. And let's get quickly to our guest. We have with us Dr. Claudia Lapidus. You were here once before,
Yes.
I believe, yes. And you came in late, actually.
Unfortunately, but today I got a chance to see this beautiful studio, so it's very nice.
That
Thank
was
you for having me.
the Net Car Service who actually gave her a tour of Brooklyn before they brought her here and got it. But it's good. They were
Yes.
good today?
Yes, excellent.
Great.
Thank you.
And you love Brooklyn, I understand. And the
Very
foliage.
Yes, the past few days, the beautiful days we had, I had a chance to go to Prospect Park, and it was amazing. The colors, the orange, the red, and Central Park was also beautiful, so I'm enjoying this time of the year.
Well, we're talking about red, and we like, the brightness of the color is
Yes.
nice. It's like the foliage.
Yes.
And I know you have two very bright sons. One is in Stuyvesant High School.
One is in Stuyvesant,
Very
and
good.
now one is in St. John's Graduate School, so I'm proud of both of them.
Fantastic. We're going to have a great, Dr. Lapidus is an expert in radiology, so any questions that we have, we're going to get a lot of help tonight. Now let's go to Dr. Stevens, who's gracing us for the 4th time?
I believe it's the 4th time.
fourth
Happy
time.
to be here for the finale.
For the season finale.
Season finale.
And it's just some of the things that you do. Now, I know you went up to Mystic, Connecticut, we heard in the...
Yes, it was beautiful this weekend. We saw some of that foliage, beautiful colors, went to the aquarium, very relaxing.
What about that Mystic Pizza? Was there a movie, Mystic Pizza?
Mystic
What was
Pizza,
that?
highly recommend it.
Yeah?
Yeah.
That was nice. That's nice. And any interesting cases come to mind the past week in your surgery cases?
Always interesting cases. Every case you do is unique and different. So
And what
that's
I
why
love about
approach
Dr.
things.
Stevens, most surgeons go in, they cut, and you get a big scar. If he has to do that, he'll do that. But many times he can do the surgery with no scars at all through a very small incision, right? I mean,
there's a scar, but it's very well hidden in the belly button, so you don't even see it afterwards. So that's sort of on the forefront of laparoscopic surgery now.
so I know our viewers, I mean, this is the person, if I need surgery, I hope I don't, this is who I go to. So I hope we're going to get a lot of calls for him and questions and any complications you might have had. So Dr. Stevens, thank you.
Thanks for having
And
me.
Dr. Rusi, it's a pleasure. And the best part about you, your mother, who's a big fan of the show.
Yes, she is.
Marietta?
Yes, that's
Yes.
good memory.
Where's she in New Jersey?
Southern New Jersey.
Very nice, very nice. Is that where you were born? Or-
I grew up in South Jersey, Medford area, not too far from Philadelphia.
Okay, so anybody out there, Dr. Russi is one of the top pulmonary physicians. And you getting a lot of questions about the swine flu?
Yes, quite a bit, quite a bit.
Yeah, a lot of fear, right? When we put fear into people, now we don't have vaccines.
Absolutely.
So.
I got 2 calls today in the office, patients inquiring where to get the vaccine, and so far I have to tell them it's not available right now for most people. I actually called the Department of Health, and they said in November it should be available.
Well, one of the things I know, just quickly, because we'll probably, when you come back next season, we'll talk about it, a trip to Argentina scheduled for next week?
Yes, so not only am I excited about being on the finale today,
Yes.
but in 9 days I'm going to be in Argentina for vacation. Actually, colleagues at the hospital are getting married, and they're having
Wow.
their celebration there. So a few of us from the hospital at Methodist will be sharing in
Do you
their
have
celebration.
to give a gift if you go all the way to Argentina? Does that count for the gift?
I guess so, yeah.
Okay. But anyway, so if you're watching, you know you're not getting a gift. All right, but anyway, thank you so much for being with us.
Thank you.
And we got a tremendous show. I mean, the phone calls are going crazy, but we have an interesting thing. I want to share a conversation that I had with a Dr. Chris Comfort. He's the medical director at Calvary Hospital, an amazing institution. You've probably heard their commercials about how they help people at end of life. And I want you to see this video. It's very impressive, and you're going to see a lot of them on this show. So Dr. Chris Comfort's interview, please. And what a great pleasure it is to have Dr. Christopher Comfort here with us today, who's the medical director for Calvary Hospital and its affiliates. And we're going to be learning a lot about that system today. But first I want to learn a little bit about Dr. Comfort. And welcome to our show.
Well, thanks for having
Very
us,
good.
Dr.
We
Garber.
welcome you from the entire, all of our listeners are very excited about this.
Mm-hmm.
And tell us, I don't detect the New York accent as we were talking before. Where are you from?
Well, actually from Washington State. I'm a transplant here to New York. I've been here now for about 25 years.
Wow. And, you know, most doctors don't even get exposed to end-of-life care issues. You know, we're a little squeamish. We want to shy away from it. And you went into this field. What was the catalyst? What made you want to go into this?
Well, I started in practice in the Bronx. I guess I had the honor of being a country doctor in a city area. And I found that most of what we do as doctors taking care of patients is accompanying those patients through everything, through good times, through illnesses, and most importantly, we end up accompanying both patients and their families through death. So the end of life is a time when the doctor being there, not only for the patient but also for the family, was extremely important, and I think I naturally gravitated to doing work that Calvary has done for at least 100 years.
Over 100
here in
years.
New York.
And we hear about Calvary, and we see, you know, people thanking them for caring for their wife at the end of her life, making them die with respect, helping them to die with respect. How did Calvary get this idea? I mean, how did it start?
Well, there's an amazing history to the services at Calvary. They began actually modeled after services that were provided in Europe in the late 1800s. There was a widow here in New York who saw some of the work being done, came back to New York, started probably the first hospice in the United States here in New York City, began that work, continued the work into the early 1900s when the facilities moved to the South Bronx, and then in 1978 those facilities moved to the part of the Bronx where we do our work.
Now, the name Calvary, what is it? Tell the audience what that means.
Calvary, as you know, is the place where Jesus was crucified. And it was a time, as we understand, of tremendous personal suffering for Christ. And the idea is, here is a place that is the final resting place for these patients, and the great concern that we would have, the care that we would give, is part of the care that we hope would be given at such a desperate time.
So it's a mission-driven organization. This is not a business. This is to help patients deal with a part of life that everyone's going to go through.
Absolutely. And the mission is for not only the patients, but that mission is to take care of the families who end up going through an awful, awful time. And we attempt to make that a little bit better.
So let's say I got a family in Crown Heights. I'm here in Brooklyn. I don't want to travel all the way to the Bronx. I can't do it every day. It's impossible. Am I stuck, or what do I do?
Well, you know, for years and years, we ran a program in the Bronx so that if you lived outside the Bronx, Manhattan, Queens, or Brooklyn, you had to travel to the Bronx to receive the care that Calvary delivers. About 1999, some plans were made that said a simple thing. If you live in Brooklyn, if you live in Queens, where you want your care is Brooklyn or Queens. So we began the process of beginning a satellite in Brooklyn, which was opened in 2001. That satellite is at Lutheran Hospital.
Not far from here.
Not far at all. In fact, the services that we offer there are the same kinds of services that are offered in the Bronx.
But how am I going to get employees who are Calvary? Am I going to get Lutheran employees who may not know all of the tricks of the trade?
Oh, this is Calvary, Calvary, Calvary. So the people employed, the people trained, and the mission at the Calvary satellite is exactly the same as Calvary in the Bronx.
Now I'm going to take it further. Now I live in Brooklyn, but I can't get to Lutheran every day. It's too much. Is there any way you can help me?
Well, when you think of end-of-life services or caring for dying patients, there are two places where that happens. One could be at a facility such as Calvary Lutheran. The other is at home. And so we have developed an extensive service of hospice services that are available to all residents within Brooklyn, Queens, Nassau, which allows for patients and families to stay at home and to receive hospice services through the Calvary Hospice. It's another way of reaching out to the community, allowing community members to stay at home for these services and have those expert services delivered.
Now, what are the out-of-pocket expenses? You know, I have an insurance, but does insurance cover this?
Well, now, interestingly enough, these are services that have been recognized as medically appropriate services and are covered by all insurances, both the inpatient type of care that's given at Calvary, at the Lutheran satellite, as well as the home care and hospice services that can be delivered here.
You know what? I visited Calvary. It's an amazing place. And I'm not just saying that because you're here. It was so heartwarming. My daughter's a medical student, rotated through Calvary, and actually couldn't stop talking about it. And I think what I noticed was people who are not up to date on how to care for somebody who's dying don't give often enough pain medication. They say, oh, I don't want the person to become addicted. You know, some nonsense like that. You know, give you a theory or how you approach pain in the dying patient.
Well, the tragedy of most types of patients that we take care of, and that's primarily cancer patients, is that cancer at the end is a condition of pain. And the difficulty is that it's different kind of pain that you typically see in these patients than the usual kind of patient with a new fractured leg, new trauma. These are patients who have had pain for a considerable period of time. They've been on strong medications, and they often, as the disease progresses, needs higher and higher doses of these pain medications for adequate control. So we have a basic way of looking at it. No patient should have pain as they are entering into the last stages of their life, and whatever we can do to control that pain is absolutely necessary.
No, unfortunately, we don't have a lot of time, but I know our patients, do have our viewers who may have this problem. They might be in Staten Island, Bronx, Queens. How do they call? How do they get in?
Well, we invite all inquiries about these services. This can come from your doctor. This can come from you personally. And there are phone numbers available for information as well as for the process of application for the services. We have a centralized number for that, 718-518-2300, and we invite those calls, even if you're not sure, for information.
Now, one question I have to ask, because I know our viewers are dying to know, in the Bronx, where do you go for the best meal? If you got a special meal, where do you go?
In the Bronx, you go to the Little Italy area. It is off Fordham Road. Find yourself any of the Italian restaurants, and you'll have a wonderful time.
And we're getting them back, because this is an amazing story. And I know you guys have questions you want to call in, so look for in our next season to have Dr. Comfort back and spend a little more time with us.
It's been an absolute pleasure.
Great to see you. I see, but Dr. Comfort's quite the politician. He wouldn't give a restaurant, right? We said, he said Arthur Avenue, but he didn't want to go into detail. But it's quite interesting talking to him, and that Calvary really is an amazing place. If anybody's ever been there, had a relative, they do work that's really God's work. So thank you, and it's a pleasure to have them with us as part of Ask the Doctor. So now we still have our listeners who are still holding on. We have very patient listeners, and we're going to go to Dorothy. Hi, Dorothy.
Hi, how are you?
Dorothy, now there's a rumor. I don't know if it's true that you have an answer to the quiz.
Which is?
Is that true or false, that rumor?
I think that rumor is false because I don't even know what the quiz is.
This is something that this is why I knew it could be a rumor. Yes, yes. The quiz, did you hear the quiz?
No.
Okay. The most popular selling Christmas song of all time. You had to sing the first 2 verses of that. But I think you're going to pass on that, Dorothy?
I think I will.
And the second one was to rhyme 2 cities that in the United States that consist of 6 letters each that rhyme with one another.
I will pass.
We pass on that one too. Very good. Do you have a medical problem?
Yes.
Okay.
I do.
What can we do?
I have. I've been diagnosed with severe cervical spinal cord impingement.
Okay.
And also herniated disc. Now the impingement is in the what they call C4, C3-4,
Mm-hmm.
and the herniated disc is C4 through 7.
Okay. Can I ask you, did you have any accidents or it just happened?
No, it happened. It just happened, and I wanted to understand the difference between. Are we talking 2 different problems of the spine, or are we talking the same problem of the spine?
Okay. Now, one of the ways you diagnose this is with radiology.
I've had MRIs and
So let's
CT.
ask Dr. Lapidus what she would look for in an MRI and what she thinks.
Okay.
Well, on the MRI, we can nicely see the bones, and then we also see the discs.
Yes.
So when the disc is bulging and pushing, we're saying a herniating disc. So that was, you had C4 through
7.
It's in the neck.
Herniation.
So
Yeah.
basically what happens is that between the vertebrae you have the disc and it's just out of place, it's herniating, and that's that part. The impingement could be due to a different kind of anatomy. If you have a little bit of so-called stenosis where the spine is a little bit shorter at some levels, like posterior aspect of the spine is a little bit shorter and can give you a little bit of narrowing, and that narrowing can cause a little bit of impingement on the cord. So the disc is actually the material that's herniating out of its place. The impingement may be more due to the narrowing of the spine itself, the posterior aspect of the space, exactly, narrowing of the space itself.
Okay, so that means that there's 2 separate issues within the spine.
Exactly. It's just 2 different processes. One is just anatomy. The other one is actually bulging of the disc into that posteriorly and a little bit pressing on the cord.
And Dr. Stevens, have you, you must during your surgery training, you must have seen this?
Of course, during neurosurgery, I see this a lot. So, there are different ways to treat this. You can try more non-invasive ways with steroid injections, physical therapy, depending upon how much this is interfering with your life. And the last stage is surgery. And basically what they do, it's called a laminectomy. They take out that piece of the bone and fix the disc. They make the disc smaller, and then they put an artificial piece of bone to reconstruct it. So those are the different options, and you talk to your medical doctor, neurologist, and/or surgeon about that.
Dorothy, thanks so much for the call.
Okay,
Feel better. Mary?
Yes.
Hi, Mary. Now, there's a rumor you have the quiz answered.
Yes, I have. I think I have an answer to one of the questions.
Okay, which question are you going to go for? The Christmas song or
the cities?
The cities. That's a tough one.
Okay. Boston and Austin.
Austin and what?
Boston.
Spell that, please.
Boston. Boston.
Absolutely correct.
Yes.
This is, how did it just came to you?
Yes, right away it came to me. Well, they're both state capitals.
Yeah, that's tremendous. It's a pleasure to send you the plaque. Have you heard about the winning?
Oh, absolutely.
You get the handmade Japanese plaque.
I can hardly wait.
And you have a spot for it in the house?
Oh, absolutely.
Is it in the bedroom?
Oh, no, going right.
I don't want to get personal. It's okay. but thank you so much for that. That's tremendous.
Okay.
We're very happy. Now the rest of the audience is sighing, but there's still one other question to go.
Okay.
Okay, be well. And you'll give us the name now off the air, okay? We'll put you on hold. Thank you. Oh, boy. I don't know about you, but that, Eileen? Eileen?
Yes.
Hi, Eileen.
I'm fine, doctor.
Now, you're holding online for the quiz, I hear?
Yes.
Okay, you're going to tell us about the Christmas song?
Yes.
Now, it's critical. You must sing the first 2 verses.
Well, I don't have the 2 voices. I'm 87. I'm lucky I got 2 lines.
Okay, the 2 lines are good. Let's see the 2 lines. Let's hear it sung, though. You got to sing a little bit.
I'm dreaming of a white Christmas
Yeah.
just like the ones I used to have.
Excellent, excellent, excellent. How did you get that one?
Well, I'm in World War II. They sang it.
All right. Do you know who wrote it?
And no, was it?
Irving Berlin.
Yes, I was trying to think.
Tremendous, tremendous. So you're also going to get a plaque sent to you. Our puzzle man, Linda Lapatos, is going to be busy at work getting these puzzles, the plaques together, but it should be on its way shortly to you.
Oh, thank you, doctor.
So what we want to do is to make sure that you get it. I'm going to put you on hold, and you'll give your name to the off-air people.
Uh-huh.
Okay. Do you have a medical question?
No, I'm pretty
Beautiful.
good, thank God.
Very good. Be well.
Thank you, doctor.
Okay. We're now going to go to John. Hi, John.
Hi, how are you?
John, where are you calling us from?
Dyker Heights.
Were you amazed at those answers?
I was surprised, actually. I was going to answer it if she hadn't done it already.
Were you going to sing?
I was not going to sing. I was going to answer the cities, though.
Okay, very good. So what can we do for you tonight?
I actually have a question for Dr. Rusi, the pulmonologist.
Sure, Dr. Rusi.
My aunt she developed this annoying dry cough around a month ago. She had a chest x-ray, which was normal, and she's been on antibiotics, but there hasn't been any improvement. So my question for you was if there are any other tests that she should have.
Hi, John. I think that's very admirable that you're calling on behalf of your family member, but it's quite common that patients come to see me as a pulmonologist with a cough after the usual antibiotics and chest x-ray have been done, and still the cough exists, and we have to start thinking about other things that can cause cough. Some common things such as acid reflux can do it, postnasal drip. Asthma is also a big one, so commonly unexplained cough, and when someone comes to see me in the office, I'll do a breathing test to see if they do have signs of asthma. There's a long list of other things besides that. John, do you know, does she have any other medical problems?
I know she has high blood pressure, but I think that's the only other major issue that she has.
Right. That could be a clue, because there's certain medications that can cause cough. Do you happen to know what medications that she's taking?
She recently started something called Vasotec.
Vasotec?
Yes.
Okay, Vasotec is actually the trade name for a medicine called enalapril, which falls into a category of blood pressure pills that can cause cough in 15 to 20% of patients who take them. So I think it would be interesting to know when she started the Vasotec and see if it coincided with the cough. And certainly I think that could be, I would have her ask her doctor about that possibility, and the solution is very simple. They could switch her to another antihypertensive that does not cause cough, that is in a similar family, a cousin of it, typically something called losartan, otherwise known as an ARB. So I would ask, it'd be interesting to see if the ACE inhibitor, the Vasotec, is the culprit.
Very interesting. Thanks for the call, John.
Thanks very much, doctor.
Okay, we now have Larry on line 2. Hi, Larry.
How are you, Dr. Garner?
Oh, Larry from Rockland County.
Yes. How are you,
Very
Doctor?
loyal listener. Watches on the computer almost every Tuesday night. We haven't heard from you in a while.
Well, yes, my granddaughter had some basketball scheduled, and I had to attend to cheer on the team. I have a question for Dr. Stephens, if I may.
Sure.
I have a friend who's very overweight, and he's been told he'd better lose some weight because he's having difficulty walking. And I know there are different types of bariatric kinds of surgery. Is there one that's, I should say, which is the most effective, and which is the least invasive kind of surgery that you could recommend for something like that?
Dr. Stephens.
Great question, Larry. So it's a complicated question, though, and there's really not a simple answer for that, but I'll do my best. So basically there are two main surgeries for weight loss that are commonly used today in this country, and that's the gastric bypass and the lap band, which is basically a band that goes around the stomach and prevents you from eating a lot during the day. Both of these are done laparoscopically, minimally invasively today. So every patient's different, and there are pros and cons to each operation. Each operation has benefits, and each operation has risks specific to that operation. So in general, the gastric bypass has a slightly higher complication rate, and the lap band is tolerated a little better. and a little less invasive. With the gastric bypass, you lose weight more quickly. With the lap band, you lose weight more slowly. But in the end, if they're done well and you're compliant afterwards, you can lose equal amount of weight with both operations. So really, it's a personal decision between and a discussion with the doctor and the patient, and it's really, they're both excellent operations.
I see.
That's interesting. So there, it's not just one size fits all.
No, there's not one good operation for every patient. It's really a lot of factors go into making the decision.
So the best thing would be for him to see you, right?
Absolutely, or any other bariatric surgeon, yeah.
Okay. Well,
this is the guy you want to see.
We want the best. That's okay. I appreciate that.
Thanks, Larry.
Thanks. Thank you. We'll talk to you after the start of next season. Don't go away, okay? Now, we're going to talk to Mary in a second, but I just want to give you the other quiz that's going to be on the forum, so you can't call in for this one. You got to go on the computer. And the easy way I do it, I go to Google and then I put netny.net, and that gets me onto the website, netny.net, and then I press Ask the Doctor, and I go to the forum. You'll see the forum comment, and then it'll come up. You'll see some interesting articles. And the quiz that you're going to find there is, out of all the books in the Bible, which one has the most number of chapters? That's a tough one. Out of all the books in the Bible, which one has the most number of chapters? Whoever answers first on the forum will get a plaque. And so it's something, go onto that forum. It's a way to get on there, but it's an interesting answer that you'll find out. Okay, let's go to Mary. Hi, Mary.
Doctor, how are you this evening?
Mary, where are you calling us from?
I'm calling you from Manhattan, 90th Street on 2nd Avenue.
Beautiful area, yes. Have you ever called before?
No.
Very good. And we don't get many callers from Manhattan, around 90th and 2nd. Is that near Elaine's?
Yeah, a few blocks away from Elaine's is on 89th Street.
Do you like that place or no?
Yes, very nice.
A lot of celebrities go in there, right?
Lots.
Yeah. I've been in there occasionally, so.
Okay.
But anyway, Elaine, so what can we do for you?
I have a question for you, doctor. I have a prolapse it's different to what you're talking about now, but I have a prolapse in the rectum.
Okay.
And it's penetrating the wall of the vagina area.
Okay.
My question to you is, what can be done for that?
Okay, I'm going to ask Dr. Stevens, who sees these type of cases, to first tell the audience what a prolapse is and then what could be done about it.
Okay.
Oh, okay.
Hi, Mary. So, this is a very common problem with prolapse of the rectum, and it happens more. How old are you, Mary?
I'm 64 years old.
Okay.
I had a fall.
You had a fall, okay.
Yeah.
So this problem happens with age and with disability and time in bed. So
I never have any time in bed. I'm working. I'm a full-time worker.
Very good. So I understand this must be a problem for you.
Yeah, I have a lot of pressure down there and urgency, and it's just very, very difficult.
Yeah, it's caused by constant straining and constipation. So when you get to this point, there are different procedures that can be done to repair this prolapse. There are different types of surgeries.
You're talking about opening your stomach or not?
Well, there are procedures that can be done through the abdomen, like you said, with the surgery, and that can also be done through the rectum, so you don't have to make an incision in the abdomen. And depending upon your surgeon and the degree of the prolapse, it can be handled in both ways, and depending upon your health and your activity level. So it can be handled without making a big incision, absolutely.
Okay, well, thank you, doctor.
Be well, enjoy.
Do you want me to hold on, or I'm okay?
No, we're glad we're okay, but call us back next season in January so we can hear how you're doing.
Have a good holiday season.
You too. We'll go to Barbara now, who's waiting patiently. Barbara?
Yes.
Hi, where are you calling from?
Flatbush.
Flatbush, not far from here. And where do you like to eat in Flatbush?
Excuse me?
Where do you like to eat when you go out? That special meal that you want to stay in the neighborhood. Where would you go?
Sometimes Junior's.
Junior's, that's nice. How is that cheesecake still good, or it's not as good?
Well, considering what recently happened, what they claim, I don't know.
What happened? I missed it.
You don't want to know about that on air.
Oh, no, okay.
We're not on the air right now, are we?
Well, we're not. No, but you could tell me.
Oh, they found mice.
Oh my God.
Yeah. So.
Okay, let me put you back on the air. Okay. So, what's the problem? Hello, Barbara.
Yes.
Hi, you with us on the show?
Hi.
How are you?
I have acid reflux.
Oh, acid reflux.
And I have every now and then mucus, and I wanted to know, does eating sweets make it greater?
Acid reflux and sweets. I know, Dr. Russo, you probably see patients with acid reflux. It may manifest in other ways. What about sweets and acid reflux?
Absolutely. Acid reflux is most notoriously associated with spicy foods, chocolates, unfortunately, caffeine, maybe certain sweets. But as a pulmonologist and acid reflux, again, it's a common cause for cough. And there's actually an association, a link with acid reflux and asthma, where the two of them, there's an interplay. So often treating the underlying acid reflux will help control the asthma. I think the important thing is diet, watching, again, spicy foods and certain things. And certainly there's a whole host of medications, PPIs, proton pump inhibitors, H2 blockers, antacids. And it's something that really you have to treat, because if you are untreated and have long-term acid reflux, it can cause problems, even cancer of the esophagus. There's something called Barrett's esophagus, where over a long period of time, the cells change in the esophagus and they can turn into a cancer. So it's something that's important not only to help you feel better, but to prevent that rare, bad complication.
Barbara, I just want to ask Dr. Lapidus, who's next to me, how she would diagnose a hiatal hernia, which is one possible cause, or even C reflux. Is there any way you could do that radiographically?
Right. What we do in radiology, we do an upper GI series where we ask you to drink some barium and swallow some crystals, and we evaluate your esophagus, the way you swallow, and we also look at the stomach. And many patients that have reflux may also have hiatus hernia. And we know that because we see where the esophagus, which is the pipe here, that goes to the stomach, where it ends and where the stomach is with respect to the diaphragm. And so when it's high, we know that there is a hiatus hernia. We can also check for reflux. We ask you to turn side to side. We ask you to bear down. And it's important for us because we can see how high the reflux goes. And we can say there's a small reflux going just slightly into the lower esophagus, or it can go all the way up, and sometimes people feel something in their throat, so because the reflux can go all the way up to your throat. So we can evaluate that, and we could see changes with Barrett's esophagus. We can look for strictures. We can look for cancer changes as well, although most patients will end up with an upper endoscopy, and their doctor will look at the esophagus and the stomach that way.
And Barbara, I just want to go to Dr. Stevens. I know you do this surgery for hiatal hernias.
Yes, and for acid reflux. But surgery really is a last resort for acid reflux. Definitely, like Dr. Russo explained, medical treatment, diet modification, and lifestyle modification. And if you're maximally medically treated and you've done all the modifications and you're still having severe acid reflux, then you can go for surgery.
Thank you.
I hope that helps.
Yes, thank you.
Okay, bye. We're going to take a break in a minute, but first let's go to Helena, who's going to be our last caller before the break. Hello, Helena.
Hello, Doc.
Hi, how are you?
I'm good.
Where are you calling us from?
Jamaica, Queens, New York.
Jamaica, Queens, and not far from the Old Mary Immaculate Hospital.
Exactly, but no, it's closed.
Closed, that's sad.
Yes.
Yeah, so is there any place left to eat around there?
Well, Doc, I'm in a wheelchair, so I really don't know much about the eating places.
Well, what do you like to cook?
I'm in a wheelchair. I don't. My home attendants cook.
Oh, okay. What's your favorite meal?
Rice and peas.
Rice and peas?
And jerk chicken, yes.
Very nice. So what can we do?
Yeah. Well, I gave my doctor, endocrinologist, a urine specimen, and he called last night for the results. I'm a diabetic. I wanted to check for protein, but he said no protein was found, but I do have E. coli. I mean, I'm in a wheelchair. How would I get E. coli? And what is the worst that could happen, Doc?
Okay. Any one of our panel would like to take that? Dr. Stevens?
Sure. So, this is a very common problem, this is a urinary tract infection. And basically, from being how long have you been in a wheelchair?
Almost 7 years.
Almost 7 years, okay. So, It's very common to get what's called an asymptomatic urinary tract infection when you're in a wheelchair or bedbound, meaning you don't have any symptoms. You don't feel any burning or anything like that.
No, but I do pee a lot.
Now she feels the
Yeah,
burning.
okay, so you're having maybe some symptoms. And it just happens when your urinary tract gets infected with a bacteria that's not supposed to be there. And what you probably need are some simple antibiotics, a 3 or 5 or 7 day course that your doctor can give you, and that should clear it up. And it definitely should be treated.
Yes, he wants me to come in. But the thing about it, I tell him I'm allergic to penicillin and to sulfur. So he says, you have to come in and see the infection doctor.
Right, and again, this can be treated. There are plenty of medications that you would be able to take.
I see.
Dr. Russi, a lot of you, any patients in wheelchairs, any special problems they might have?
Yeah, it is, like Dr. Stevens mentioned, it is quite common. In fact, the fact that you already know that it's E. coli, that's probably the most common cause, and there are antibiotics that you can be treated with despite the allergies that you have. Cipro, you may ask your doctor about putting you on ciprofloxacin. That should take care of it. And
how do you spell it, Doc?
You could say Cipro, but
Cipro.
ask the doctor. C-Y-P-R-O.
Yeah.
And it's such a C-Y-P-R-O, Cipro.
Okay.
But it's so nice to hear from you.
Thanks, Doc.
Are you going to call us back after we go into our 10th season?
Sure, and when will that start?
Right after New Year's.
Oh, hallelujah. Thank you.
Don't celebrate too much New Year's Eve. You don't want to miss the show.
No, okay, I love your show, yes.
Take care.
Have a
Bye.
good evening.
We got to take a break now. Got to pay the bills, and Calvary's knocking at the door. So no, they're not knocking. But our phone number is 718-499-6101, and you can talk to us about radiology, laparoscopic surgery, general surgery, any type of surgery, and lung disease. So we'll take a short break. When we come back, we'll get to the phones at 718-499-6101. We'll be right back. I'm Dr. Steve Garner, the host of Ask the Doctor. In addition to watching Ask the Doctor every Tuesday night at 8, you can also visit www.netny.net/askthedoctor. There you can find the topics and guests of each episode. You can read my column from the week for the tablet, and for more advice, you can watch episodes you've missed. More importantly, you can post your questions and I'll answer them on the video blog. So visit www.netny.net/askthedoctor and get your daily dose of healthy advice. Welcome back to this great episode of Ask the Doctor, where our topics are radiology, laparoscopic surgery, and lung disease. With me I have again Dr. Claudia Lapidus, Dr. Daniel Stevens, and Dr. Thomas Russi. The number to call is 718-499-6101. Let's get to our phones. We have another Barbara. This seems to be the most common first name tonight. Hi, Barbara.
Hi.
We have a lot of Barbaras tonight. How are you?
I see. Thank you. I'm well.
Where are you calling us?
Hello?
Yeah, where are you calling us from, Barbara?
From Jamaica, New York.
Another Jamaica. The person before you was just from Jamaica.
Yes.
She said there's no good place to eat around there. What do you say to that?
It's not. I go all the way out to Elmont.
Elmont. Where do you like to go out there?
Sizzlers.
Sizzler. You ever go to the racetrack out there?
Once in a while, I used to, yeah.
They have a nice place to look over the field there. Very nice.
Yeah.
So what can we do for you?
Okay, when I walked in the door, I heard you talking about the back surgery.
Yes.
And I believe you said laminectomy. I'm not sure, but I would like to know what's the real name for that operation?
Sure. Dr. Stevens was talking about the laminectomy. Dr. Stevens?
That's exactly right, Barbara. It's called the laminectomy. And usually it's for a herniated disc or a spinal stenosis, which is a problem with the spine causing neuropathies and pain. And what you do, the neurosurgeon does it, he makes an incision basically right over the spine, and you take out a piece of the bone and fix whatever needs to be fixed. You can make the disc smaller and widen the spinal column. And then you basically take a piece of fake bone or real bone and put it back and reconstruct the spinal column and fix the underlying problem. It's a laminectomy and discectomy.
Interesting,
okay.
Interesting.
Okay, you see, what happened here is that I had surgery at Hospital for Special Surgery. I had both hips replaced. And I'm thinking about this back surgery because I've had this pain a very long time. I'm 62 years old. And I don't like the pain at all. I can't stand pain.
Yeah.
Well, I think it's reasonable that you talk to your surgeon, and it might be a good option for you.
Okay, then. Thank you so much.
We hope you feel better.
Thank you.
Okay.
Have a good night.
I wanted to ask Dr. Lapidus, because last week we had a little concern about radiation. And not every test that's an X-ray, or done in X-ray, is radiation. What are some of the tests that don't involve radiation that the patients could get?
Well, ultrasound, it has no radiation, so it's a very safe test, especially in children. We try to evaluate as much as we can using something like ultrasound and avoid X-rays. MRI, there's no radiation with MRI. So that is absolutely safe and can be done even in pregnant women because there is no radiation. So these are the two tests we use most of the time, ultrasound and MR, no radiation.
So that's good to know. You know, even this back question that we're talking about, if we do it by MRI, there's no radiation. And we want to try and keep it down to the lowest level. So always ask your doctor, can I do this without using radiation? Rosemary. Hi, Rosemary.
Hi, Dr. Garner. How are you?
It's nice to hear from you.
Yeah, you haven't heard from me in a while.
I know. Did you ever win the quiz?
No, I never won the plaque. I'm trying to win it right now.
Oh, which one were you calling in for?
Well, the one about the chapters. Remember that you just said?
Oh, the chapters. Yeah, but you can only do that on the forum, so you don't want to.
That's what I was trying to do before, but I never won the plaque.
Okay, I got a good feeling though. I have a good
do?
feeling about you tonight. Yeah.
All right, I'm trying.
Okay, what can we do?
Anyway,
for you?
my question. I'll tell you what happened. My back has been bothering me. I had pain, so I went for a back X-ray, and the radiologist read it as a shift in L4, L5. Now, I was wondering exactly what that is.
I'm lucky to have one of the top radiologists in the city next to me, so she's going to tell us a little bit about that shift.
Bit what that means, yes.
When we take an X-ray of the back, we take a lateral view of the spine, and we look at the alignment of the vertebral bodies. And usually they all should align, and there's a nice curve that's formed, and the disc is this uniformity in the disc space as well. With degenerative disease, with arthritis, what happens is that you have the disc gets narrowed, the ligaments get a little bit hypertrophied, sometimes get a little bit weakened, and you can have the vertebral bodies kind of slide one over the other. And that's the alignment of the vertebral bodies is a little bit abnormal, and we will describe it. And there's also grading of that. Is it grade 1, grade 2, grade 3? Just the severity of this misalignment. Okay. And it's basically due to degenerative arthritic disease.
Didn't realize it was with the arthritis.
Yeah.
I thought maybe it was something I did to shift it, you know.
Oh.
Anything you could tell me to do about it?
Well, I think the important thing, whenever we take any kind of an X-ray and there's a finding, to correlate whether that finding has anything to do with your symptoms.
Right.
Because if it does, if the level, and the doctor can say what level the misalignment is at, and if that is the level where, for example, there is neurologic findings you have, and if it corresponds to that level, then it obviously needs to be evaluated further.
Right. He mentioned
I'm sorry.
Spondylolisthesis, I think.
Spondylolisthesis. So there is a spondylolisthesis. That's the malalignment. Usually there's also could be spondylolysis when there's a little bit of a break in the bone.
Right.
Right.
Okay.
So MRI could be the next step to evaluate for disc. That would be something that can be done.
Rosemary?
Right. Yes.
Thank you. Are you busy? Are you moving? Or you're not the Rosemary who's moving?
No, I'm not moving.
Where are you living now? Yeah. So we hope you feel better.
Thank you, doctor. I'll be calling back. I'm doing okay.
Call back after New Year's.
Okay.
Take
God
care.
bless.
Bye.
Bye.
Let's go now to Mary. Marie on line 4. Marie? Hi, Marie.
Yes, this is she.
How are you?
So far, so good.
Good. Where are you calling us from?
I'm calling you from Midwood in Brooklyn.
Midwood, right around Avenue J?
It's, yes, Kings Highway and Flatbush Avenue, that vicinity.
Do you ever go into Dubrow's, the cafe that used to be there?
Oh, yes, that was quite a place for us.
That was the best.
It was the best.
It was open 24 hours a day.
24 hours a day with excellent service.
Remember upstairs, downstairs? They had
upstairs, downstairs. My father used to come from Queens to sit in there for a while.
And then Napoleon. I don't know if you ever had their Napoleon. It's a whipped cream and decadent dessert.
When I was younger, yes.
Yes. Well, what can we do for you now?
Well, right now, after some trouble with diverticulitis, And CAT scans are many. They discovered I've developed a cyst on the pancreas and several nodules on the lung and the thyroid. Now, I'm worried this is you. At one time in your program, you said more than 5 CAT scans are not a good idea. Could this possibly from the CAT scans? Now, they're calling me back for another CAT scan, and I'm just leery about this continuous semi-annually CAT scan program.
I'm going to get you an opinion from Dr. Lapidus and then to Dr. Stevens for the cyst in the pancreas, the thyroid, and in the lungs.
The cyst is on the pancreas. The lungs and the thyroid have nodules.
Okay, it's Dr. Lapidus.
Well, I think that we don't want to do x-rays for patients who don't need it. We don't want to do CAT scans if there is no good indication. But if a patient has an indication, there is a reason to do it, then when the risks, we assess the risks and benefits. And if the benefits of the study outweigh the risk, we definitely go ahead and perform a study. So I wouldn't worry at this point about the fact that you've had a number of CAT scans. What we need to find out is exactly what's going on with your pancreas. Now, the diverticulitis, you said there were findings of diverticulitis on CAT scan. Well, that's, I guess, being taken care of. The pancreas can be evaluated with the CAT scan.
The doctor told me for the pancreas not to worry.
Well, no. We have to evaluate the pancreas. You said that there is a lesion in the pancreas. There's a cyst. There's a couple of things we can do for that pancreas to evaluate the lesion. We could do an ultrasound, which, again, has no radiation, and we can see if it's a pure cyst or not.
That's an answer I'm looking for, yes.
There is also MRI, which is excellent for the pancreas. But the message which I want to also give you is that if there is benefits to doing the study, if there is information that's important to obtain to evaluate a lesion and to see what's going on, it needs to be done. This radiation is more in general that we don't want to do unnecessary studies. We don't want patients to run in and do one CAT scan after another if it's not necessary. But if there is a reason to do it, by all means, it needs to be done. For the pancreas, you can do an ultrasound, you can do an MRI if you don't want to do any more CAT scan at this particular time.
Is it possible that these CAT scans caused all these problems?
No.
The pancreas?
No, it didn't. Because this happened when I was discussing that. We're talking about out of 100,000 people, maybe 2 extra cancers, 3 extra cancers. So it's it would not be plausible to think that it affected one person because you had 6 CAT scans. But if enough people have 6 CAT scans, then that's when you see the problem in the population. I wanted to ask Dr. Stevens, because he's here with us, as far as the pancreas, is that something that you can go into without cutting?
Absolutely. If they're concerned about it, they obviously found this on either a CAT scan or an ultrasound or
on a CAT scan.
On a CAT scan. If they're concerned about it at all, the next test might be what's called an endoscopic ultrasound. It's an endoscopy. They look in your stomach. Again, this is no radiation, and they use a little ultrasound, and they can take a small needle through the endoscope and take some fluid or a biopsy of the cyst.
Oh, I don't have to be cut?
No, that's not a surgical procedure.
Okay, thank you both, to all of you, so much.
Thank you. We'll see you after New Year's.
You gave me my answers.
Thank you very much.
Thank you.
Before we get to Charlie, I just want to repeat that quiz and don't do it now during the show. At the end of the show, you go to netny.net/askthedoctor. The question is, what is the longest book in the Bible, the one with the most number of chapters? And you put your answer down there under the form. And if you're the first to do it, you're going to get that plaque. So now we're going to go to Charlie, who's waiting really patiently. Charlie?
Oh, yes, doctor. How are you?
Charlie, where are you calling us from?
Brooklyn, New York.
Which part?
Gerritsen Beach.
Gerritsen Beach. Again, I went to a yacht club out there once.
Oh, yes, there is. I know which one it is. Yeah, at the end of the beach, yes.
The end of the beach. It's okay. So right?
Yes.
Well, any restaurants, real restaurants you can go to?
La Trattoria on Avenue U and East 28th Street.
Trattoria. Anybody to ask for in there?
No, but just the general reception will be pretty well for you.
I went into Gino's, actually, this week because one of the viewers said to ask for Larry.
That's good, too.
Nobody knew Larry, though. That was the only thing. But
Michael's is very good also.
Michael's, very nice, yeah. So what can we do for you, Charlie?
Yeah, my mom a year ago had colon polyp cancer taken out, and she didn't need any type of radiation. Now, this year, when she went to follow up on it about 5 months ago, she took the Muralax and she took Fordoxalak, and she passed out, and she became very dehydrated. Now, she was admitted into St. Francis Hospital for about 9 days, 7 days, something like that, and then she came home and she was okay. Now, is there any way she can, my worry is when she has another colonoscope done, which she should have done, how does she prepare for that?
Well, Dr. Stevens, how is she going to prepare for that prep without getting dehydrated?
That's a great question. There are definitely different types of bowel preps that you give. Some are a little more aggressive than others. So, number one, she may want to take a different prep than she had last time. There are different options. And number two, if she really can't tolerate it, she might need to do it in the hospital so they can give her IV fluids while she's getting the prep, and that would assure that she wouldn't get dehydrated. Those are the two best.
So make sure you do that. Anything, Dr. Lapidus? Because we do colon preps for the barymenomas and so on. Anything you add? You covered it pretty well.
Yeah, pretty well.
Okay, we're going to go now to Ellen. Hi, Ellen.
Yes.
Were you calling us from, Ellen?
Bayside?
Bayside, great area. My daughter lived in that Bay Terrace over there?
Yes, I live very close to Bay Terrace, right around the block. I live in the Bay Bridge condos.
Oh, those are beautiful.
Yes.
Beautiful. What can we do? You sound very, what's going on?
I'm very nervous. I had symptoms of a urinary tract infection, and I went to my regular doctor, and I had no infection. He told me to go see my gynecologist, and she's suggesting a sonogram looking for ovarian cancer. And I'm very, very scared. I'm 50 years old, and where does ovarian cancer come from? I mean, could there be anything else besides ovarian cancer?
Well, let's just get to the sonogram, because that's the way we can evaluate the ovaries. Dr. Lapidus?
The evaluation of the pelvic ultrasound is very simple to do, and it can be, if some of the physicians, actually OBGYN physicians, will do it in the office, and you can see, they can show you the ovaries, tell you that it's normal, just to give you a peace of mind. But ultrasound, again, no radiation involved, looks at the uterus, looks at the ovaries, and there are standard sizes and appearances for ovaries depending on the patient's age. So that can be done very easily.
No, I understand. That's not my question.
But my question to you is he thinking, do they have reason to believe you have ovarian cancer?
Yes, or could it be anything else besides, I'm ruled out urinary tract infection, so is it ovarian cancer? Can it be something else besides? I'm just nervous.
Your ovarian cancer is usually not even that symptomatic until very late. So one thing I'd be happy about in your case is that it'd be unlikely to be ovarian cancer causing this. It's something you want to rule out, but it's something that would be less likely on the list of possibilities.
So if it's not urinary tract and it's not ovarian cancer, can there be some other cause that's giving me this urge of constant fullness to urinate and I can't produce?
Yeah, I mean, sometimes you get local skin irritations that can cause the problem. Dr. Stevens, have you seen?
There are other less malignant things, polyps and benign things that can cause this, definitely. So I would be a little worried, but don't be too worried. And if you need the ultrasound, I would definitely recommend it. But there are definitely other things that can cause urgency.
But yeah, Ellen, I think that again we want you to work it up. But
I'm going tomorrow.
I think you can rest easily tonight that it's going to have that's not going to be the cause.
Okay.
Okay.
Could there be like a benign
something
cyst?
benign, something local, an irritation of the skin, little irritation.
Okay. Listen, my mom and me watch you all the time. It's my first time calling in.
Oh, thank
My
you.
mom loves you. She's 90 years old, and I have so many questions to ask about her, but I'll do it another time.
What's her name?
Anna.
Anna, we say hello to you.
She's watching in the living room.
Hi, Anna.
God bless you all. You're so wonderful.
Be well.
Thank you. You too.
Okay.
Thank you.
And I wanted to ask Dr. Rusi to have the final word. Swine flu, one piece of advice.
Hand wash is very important, and I think that just common sense, if you're having flu-like symptoms, cough, sore throat, runny nose, I wouldn't be alarmed. I wouldn't run to the emergency room. I think the important thing is if you have high fever, perhaps mental status changes.
Dr. Rusi, I got to interrupt you, but we got to close. I don't know. This show went so fast.
Wow.
I don't know what's going on here, but I want to thank Dr. Claudia Lapidus. I want to thank Dr. Daniel Stevens and Dr. Thomas Rusi for coming in, and we hope we're able to help you. It's good to remember to be proactive about your own health. Speak to your doctors about your concerns and go for second or even third opinions. In the meantime, continue to watch NET and visit our forum at netny.net/askthedoctor. We'll continue to have special contests and updates for you until our next season begins. So I want to thank you for all your calls tonight, And don't go far, because I'll see you again shortly next season. Have a happy, blessed holiday season, and keep a lookout for surprises that we have up our sleeve. So goodbye, stay healthy, and I'll see you in the tablet.